Are you suffering from a meniscus tear in your knee and you're looking for the best exercises to help you get better? If you are, then make sure you avoid the exercises from this video because they can make meniscus tears worse. Hi everybody, my name is Will Harlow and I'm the Over-Fifties specialist physio here at HT Physio in Farnham. And today I'm going to be revealing 3 meniscus exercises to avoid so you can help that meniscus tear get better faster. Now, before we dive into the content of the video, if you haven't already, please hit like on the video and subscribe to the channel, because then you'll be the first to hear about our new knee pain videos when they come out. And if you've got someone in your family or friendship group who have got problems like meniscus tears or issues with knee pain, then please share this channel with them, because then you'll help them out and you'll help our channel grow as a result. I really thank you if you do choose to do that. So in this video, I'm going to tell you what a meniscus tear is. I'm going to tell you which types of movements can aggravate it, and then I'm going to reveal the 3 commonly prescribed knee exercises that actually make meniscus tears worse. So let's talk about meniscus tears in the knee. So this is my knee model here, and it's going to help me explain what a meniscus tear is. You can see that we've got the thigh bone here, we've got the shin bone down here called the tibia, and we've got the kneecap at the front here. So a knee moves like this. This is when we bend our knee. Now inside the knee, if I bend the tibia down here, you can see this layer here that sits between the tibia and the femur. This is the meniscus. And the meniscus is basically a layer of fibrocartilage that acts like a shock absorber. So its job is to stop force from coming up through the leg into the thigh bone, and it prevents wear and tear on the knee, and it also helps to protect the hip indirectly. So it's got a very important job. But the problem is, as people go through life, they end up losing the integrity of their meniscus as we age. The meniscus dries out, so it becomes more brittle. It also develops tiny little nicks and tears in it, which are just a normal part of aging and for most people don't cause too much trouble. However, for some people, these tiny bits of damage can form into quite a big tear. And if you have a larger meniscus tear, they can often be painful. So the symptoms of a meniscus tear are pain along the margins of the joint, either on the inside or the outside of the knee, pain when you twist, and they can also cause catching, so it feels like something's getting stuck in the knee. They can cause locking, where you can't bend or straighten the knee, and they can also sometimes cause giving way, where you feel like the knee's going to collapse under you. So meniscus tears are very common. We see them a lot in the clinic. I reckon I probably see at least 2 meniscus tear patients every single day. And the issue with meniscus tears is that even though they do tend to get better with conservative treatment, they take a very long time. So people often get stuck with meniscus tears for 6 months, 12 months plus, and they can be very frustrating to treat. They're also quite easy to aggravate. So if you do the wrong things, you can feel the meniscus flares up and gets worse. And a lot of people don't fully understand which things make them better and which things make them worse, so they delay their recovery as a result. Now that comment actually even extends to other physiotherapists. And I've seen many patients who have come in to see me and they've been given a list of exercises to do for their knee pain. And I've had a look at the list, and those exercises are actually going to make meniscus problems worse. So whether the problem was misdiagnosed or maybe the therapist just didn't know that those were ones that are going to aggravate it, I'm not sure. But even if you've been prescribed exercises from a professional, sometimes they aren't quite the right ones. So I'm going to go through 3 very common exercises that I see prescribed for meniscus injuries, but these are ones that can often make it worse. So if you've been prescribed these, my recommendation is to probably stop those ones and look to do some different ones instead. So speak to your provider if you have any doubts, if you've been prescribed these. So what we're going to do is we're going to talk about the things that aggravate a meniscus tear, and then I'll show you the exercises to avoid. So there are 3 major things that can aggravate a meniscus tear. The first thing, and this doesn't apply to everyone, but it applies to at least 50% of people, is if you fully extend your knee joint, if you lock it out, to being completely straight, that can aggravate the meniscus. And the reason that can aggravate is because when the knee is fully straight, the two bony surfaces of the thigh and the tibia, they come together. So if you've got a meniscus tear, it can pinch the meniscus. So that's the first movement that can sometimes aggravate it. The second movement that can aggravate it is maximum flexion. So bending it as far as you possibly can, especially when you're weight bearing. Again, this position is when the thigh bone and the shin bone come closer together. And if you have a tear there, that can pinch the meniscus and cause an irritation to the problem. And then the third movement that aggravates meniscus tears is twisting, especially when the foot is on the floor. So the meniscus is very tightly attached to the shin bone. So when we twist, it doesn't have anywhere to go. So its only option is to tear, okay, to allow that twisting to happen. So when your foot is planted and you twist on your leg, that's going to aggravate meniscus injuries. So that being said, let's have a look at these 3 exercises that I commonly see prescribed for meniscus injuries, but I recommend to all my clients to avoid them unless I tell them specifically otherwise. So here is the first meniscus exercise to avoid for most people, and it's one I see given out all the time. It's called the inner range quads exercise. So basically what this exercise is you start off on your back, you take a towel and you put it underneath your affected knee like this, you lie flat, and then you push your knee down into the towel and you lift your foot up off the bed, and then you relax. So it looks pretty innocent, right? Well, it's actually a good exercise for many people because it strengthens up the quads. But the problem with it is, if you can see my knee here, I'm forcing my knee straight. Okay, I'm activating these muscles, which is good, but I'm forcing my knee straight to do so, which can sometimes aggravate the meniscus. Now, I'm going to caveat this by saying that this is actually a really good exercise for many problems. I have given this out to many of my patients, even meniscus injury patients. And the only reason I would give it out is if I've done an assessment and I've worked out that full extension of their knee is not going to aggravate their meniscus tear. So for some people, this exercise is still okay, even if they have a meniscus tear, but for many people, it will just aggravate the problem. There are other ways to strengthen your quads without having to do this inner range quads exercise, and the other ones can often be better for meniscus problems and not aggravate the injury. The second exercise I commonly see given out for meniscus injuries that only makes the problem worse is the deep squat. So the deep squat would look something like this. You would stand with your feet apart and you squat all the way down so that your bottom is almost touching the floor, and then you come back up. So again, it's like this. You might find some people are told to put a weight on their back and do it in the gym like this. They might be asked to get up and down from a very low chair. And again, this is a great exercise for many people. But the problem is, if your meniscus tear is still acute or it's still painful, when you get down past about here, because your knee is bending, the tibia and the femur are coming closer together, and it might just pinch that meniscus tear. So what I recommend people do instead of doing deep squats is they do mini squats. So they only come down about 70 degrees at the knees and come back up. And that is usually enough to get some work in the quads, which is a good thing, but avoid pinching the meniscus by going too far down. Of course, you'll have to do more if you're just doing the mini squats, and make sure you get checked out by your healthcare provider first. But this can be a much safer way to strengthen the quads and the glutes without aggravating the meniscus. Then the third exercise that you should avoid if you have a meniscus tear is anything to do with a lateral lunge. So I see these given out all the time, and there's 2 variations of this exercise that I've seen patients being given. The first one is the strengthening lunge, so they're going down and back up. And the problem with this is, in both sides, because I'm moving side to side, I'm getting a small amount of rotation happening at my thigh bone and at my shin bone. Now, it doesn't matter where the rotation is happening. If it's happening in either of those bones, it's going to put stress on the meniscus. So coming down to one side like this or going down to one side like this is just going to turn the knee, and it's going to aggravate the problem. The other situation where this is given is if someone's been told to stretch the adductors on the inside of the hip, and they're told to go down to one side and hold, and you can feel a stretch here. But for the same reason as the strengthening movement is not a good idea, this also is not a good idea because you're twisting the leg on both sides, and it can just aggravate a meniscus tear. So avoid those three exercises: the inner range quads where you're forcing it straight, the deep squat where you're forcing it bent, and the lateral lunge where you're forcing the knee to twist. If you avoid those three things, the meniscus tear should get better a lot quicker. So those are the rehab exercises I recommend people with meniscus tears avoid. If you avoid these exercises, for most people, the problem does get better quicker. So if you're doing these exercises at the moment and your meniscus tear is not improving, then reconsider what you're doing and see if you can find some different ones that will help the problem more. Now, I must caveat all of this by saying that in some cases, these exercises will be suitable. So don't automatically assume that you're doing all the wrong things, but it's certainly worth asking the question if you've been told to do these exercises. Anyway, that's all I've got for you today. I hope you've enjoyed this video. If it's been useful, please leave me a comment below. And if you want to get more from me, please feel free to pick up a copy of my book. It's called Thriving Beyond 50, and you can find it on Amazon using the link below this video. It's got tons more advice about knees and meniscus injuries. Anyway, I hope you've enjoyed this video. Thank you very much for watching, and I look forward to speaking to you on the next one.